amount, and since it's a Friday and we had a little less workload in the morning, so I thought to go live on the official channel. And today again I would be discussing something about V-line surgeries. So there are a lot of questions when people want to or plan for a V-line surgery. So they have a certain set of questions that most of the patient ask us, and I would like to answer those frequently asked questions regarding V-line surgery. And I would also give you insight that how do we approach to a V-line surgery, what are the things that we would like to correct in a V-line surgery, how it contours your lower jaw facial profile, and along with that how it does help in slimming of your lower face, how it makes it look more proportionate, and also what are the options if someone is scared of the surgery or want to try a non-surgical modality first and want to get sure about it and then only want to proceed ahead with the surgery. So V-line surgery is commonly also known as lower jaw contouring surgery, and good thing about it is it is a scarless surgery, because जो भी सर्जिकल प्रोसीजर होता है वो हमारे मुंह के अंदर से होता है, तो बाहर की तरफ से कोई भी एक्सटर्नल स्कार्स नहीं होते. तो जनरली पीपल कंसर्न होते हैं कि क्या वी लाइन सर्जरी के बाद स्कार आएगा या नहीं. तो उनके लिए मैं बताना चाहूँगा कि इसमें कोई भी एक्सटर्नल स्कार्स नहीं होते. तो इससे कोई भी आपका सॉफ्ट टिश्यू पे एस्थेटिक इम्पैक्ट नहीं आता है स्कार के पॉइंट ऑफ व्यू से. जो दूसरी इम्पॉर्टेंट चीज़ होती है, जो लोग हमेशा पूछते हैं कि सर्जरी में पेन कितना होता है. तो सिंस द सर्जरी इज डन अंडर जनरल एनेस्थीसिया, जनरली ये पेनलेस सर्जरी होता है. हाँ, बिकॉज सर्जरी के बाद स्वेलिंग एंड बॉगीनेस कॉमन है, उसके वजह से एक स्ट्रेच की फीलिंग रहती है. एंड इन अबाउट 3 weeks of time, about 50 to 60% of the swelling goes away, and you look presentable in about 3 to 4 weeks. The final results can be appreciated in about 8 to 12 weeks. So generally 4 से 6 महीने का गैप फेज होता है when you start seeing the exact change what we have achieved. Now V-line सर्जरी में हम किन किन चीज़ों को इंक्लूड करते हैं. सो देर आर 2 things that are included. एक तो जो हार्ट टिश्यू करेक्शन कर रहे हैं और साथ में एक जो मैसेटर बल्क कम कर रहे हैं. तो खास करके फीमेल्स में जिनका बहुत ही ज़्यादा स्क्वायर लाइन फेस होता है और उनको एक स्लिम फेस चाहिए होता है और उनको ऐसा लगता है कि ये वाला हिस्सा जो फेस का ये काफ़ी ज़्यादा ब्रॉड है, तो मोस्टली ऐसा देखा गया है कि अलॉन्ग विद द बोन. तो इफ़ यू सी हियर दिस इन फीमेल्स इट इज़ मोर ऑब्ट्यूज, दैट इज़ अबाउट 120-130 डिग्री का हमारा ये एंगुलेशन होता है. और साथ में यहाँ पे एक चौड़ी सी मसल होती है जिसको हम मैसेटर मसल कहते हैं. तो जनरली जिनका बहुत ज़्यादा स्क्वायरिश फेस होता है उनके में मैसेटर बल्क भी होता है और बोन भी आउटवर्ड प्रोट्रूडिंग होता है, जिसकी वजह से फेस ज़्यादा ब्रॉड लगती है और कंटूर नहीं लगती. तो व्हेन वी प्लान द सर्जरी तो 3 चीज़ें जो हम करेक्ट करते हैं. पहला तो एंगल का कंटूर हम करेक्ट करते हैं. दूसरा ये जो मैंडिबुलर बॉडी होती है, यहाँ पे जो बल्क होता है हम उसको कंट्रोल करते हैं. साथ में हम चिन का करेक्शन करते हैं जिसमें कि हम चिन को आगे लाते हैं. कुछ एक केसेस जिसमें कि हमें स्क्वायरिश चिन को भी पतला करना होता है, तो वी रिमूव अ वर्टिकल स्ट्रिप ऑफ बोन फ्रॉम द सेंटर ऑफ द चिन, वी कोलैप्स दिस एरिया, ब्रिंग द चिन फॉरवर्ड, फिक्स इट विद प्लेट्स एंड स्क्रूज, and then that is how we achieve a perfect V-line contour of the lower jaw. Now coming to the masseter muscle, if masseter bulk is good, then we also remove some part of the masseter muscle to give more contoured and balanced facial profile. So as I mentioned कि ये पूरी सर्जरी मुंह के अंदर से होती है, तो इसमें कोई भी एक्सटर्नल स्कार्स या कट मार्क्स नहीं आते. रिकवरी पीरियड मैंने बताया कि करीब इनिशियल डाउन टाइम 3 से 4 हफ्ते का होता है. फाइनल रिजल्ट्स यू सी इन अबाउट 12 weeks ऑफ टाइम. एंड स्वेलिंग थोड़ी रहती है, माउथ ओपनिंग में थोड़ी प्रॉब्लम इनिशियल 7-10 days रह सकती है जब सोरनेस ऑफ मसल होती है. बट इन द पोस्ट ऑपरेटिव फेज वी टीच यू रिगार्डिंग द फिजियोथेरेपी दैट यू नीड टू डू एट होम to regain complete or full mouth opening. Now the good thing is about V-line surgery is that we can also combine it with other facial procedures. For example, if we are doing bleph or we are doing a rhinoplasty, we can combine it. We can also combine it with the forehead contouring. V-line is a very important part for a transgender or a facial feminization surgery. बिकॉज जो मैस्कुलिन फेस होता है उनको जब हम फेमिनिन फेस में कन्वर्ट करते हैं तो दीज चेंजेस contributes to a lot to the aesthetic profile of the feminine face. So it's an important surgery for facial feminization cases where they are looking to get more chiseled and more contoured lower facial profile, and as I mentioned, it can be combined with other surgeries. What about the post-operative care? So generally in the post-op, the first 3 to 4 days we keep a pressure dressing onto the lower jaw line. Once we remove the pressure dressing in about 3 days on the follow-up, and then we give a chin band to wear, which helps and provides support. It also helps in maintaining the swelling in that area. And generally the medications including antibiotics and painkillers are prescribed for about 7 days post surgery, and a good oral hygiene must be kept post surgery because the surgery has been done inside the mouth, and we don't want any food particles to stick around the sutured area, otherwise it may lead to infection or wound dehiscence, which can have an added downtime to the surgery. If people wants to go out post surgery in 10 days to 2 weeks, they can start going out. As such, you don't have to remain seated at home because of the surgery. And that if I talk about the food and the diet that you have to take is about for 3 weeks we generally prefer soft diet so that you are able to chew and relax the muscles properly with the food. Post that, you can resume back to your normal diet. And वन इम्पॉर्टेंट क्वेश्चन दैट एवरी पेशेंट आस्क कि क्या इससे मेरे दांतों की पोजिशनिंग में तो चेंज नहीं आ जाएगा. सो नो, इन वी लाइन सर्जरी वी आर नॉट डूइंग एनी थिंग टू द डेंटो एल्वुलर कॉम्प्लेक्स. तो इसके वजह से आपके दांतों में कोई चेंज नहीं आएगा. सो गीता इज आस्किंग व्हाट आर द चार्जेस फॉर द सर्जरी. अगेन फॉर द चार्जेस इट डिपेंड्स व्हाट ऑल एरिया वी आर इंक्लूडिंग. The basic surgery starts in about 1.5 lakhs, and it may go higher depending upon what areas we are including, what all surgeries have been planned at the session that we are doing. If you have more questions about pricing and all, you can always send us message on our WhatsApp number, that is 8130134693, and you can also write in the comment box to ask more questions. If anyone wants to get their face assessed for a V-line surgery, you are requested to share your clinical pictures from the front and from the side profile on our WhatsApp number so that we can give you a preliminary idea, and then you can book a consult with us to have a further discussion. One important thing that is needed when we plan a V-line surgery is a CT scan. So what the CT scan gives us is, they gives us the exact picture of the lower jaw bone along with the bulk of the masseter. Also at times it helps us to customize the surgery as per your need. We can have pre-bent, pre-customized plates as per the surgical need. It reduces the overall surgical time. It also benefits in exact replication of the planned surgery on the OT table. What should be the ideal criteria for a CT scan? 0.53 to 1 mm cut slices are good enough to plan these surgeries with the CT scan. Now, the other important aspect is sometimes we do the angle contouring and the masseter, and we might not need a genioplasty or the chin correction because the chin is okay. So it all depends upon the planning and evaluating the person physically and discussing about the needs. So whenever you are planning for these kind of surgeries, I request all the people to undergo a detailed consultation. If you have doubts, you can again go another round of consultation, and then you can look forward to getting these surgeries done. Now, one important thing with V-line surgery is if planning is not done right, you might not be able to get a good result. So I always emphasize that patients who are looking forward to V-line surgery, they should get a detailed discussion about your expectation with your surgeon, so that your surgeon and you are on the same page before the surgery is taken up. And guys, I request you to follow our YouTube channel along with our Facebook page and Insta handle, so that you keep getting updated about the videos that we make on various surgeries, including the facial surgery, the body surgeries, and the other plastic and cosmetic surgeries that we do here at SB Aesthetics. And if you have more questions or doubts regarding any of these surgeries, you can ask us through WhatsApp on the comments, or you can also mail us on our email ID. And you can visit our website. There is a lot of content and details present around these surgeries. We have made a lot of videos on various topics, so you can also watch them to get detailed insights about these surgeries. We have another official handle by the name of SB Trichology, where we post a lot of hair related videos regarding hair transplant, regarding PRP therapy, regarding GFC therapy, regarding exosomes. So if anyone is looking forward to hair treatments, you can follow SB Trichology as well to get more information. You can always discuss out your problems with us, so that we are able to help you. और दीपक केसरी जी हाय बोल रहे हैं, गुड मॉर्निंग बोल रहे हैं डॉक्टर साहब. गुड मॉर्निंग दीपक जी, कैसे हैं आप? और it really feels good to connect with you guys through live and share information, so that it helps you in your decision making and making you guide through the process if you're looking for a treatment, or if you have any suggestions. If you want us to make video on any topic, you can also ask us to do so that we can make videos on interesting topics more and more. So thank you guys, thank you for joining this live session. I hope everyone a very good day, and see you soon.